Hey guys, it's Meris with Level Up. Hey guys, it's Meris with Level Up RN, and today I want to tell you about a condition you may have never heard of. In medicine, we often live by this rule called Occam's razor. And the idea behind Occam's razor is that the simplest explanation is typically the answer for whatever a problem may be. And you might have heard the phrase, when you hear hoofbeats, think horses, not zebras. But sometimes it is zebras. I have a condition known as familial Mediterranean fever, or FMF, which is a rare genetic disorder classified as a periodic fever disorder. As the name may suggest, the people who are most likely to be afflicted by this genetic condition are those of Mediterranean descent, and this is a condition that causes a defect in the protein known as pyrin, and as a result, it leads to the afflicted patient having an inappropriate inflammatory response the way that somebody else wouldn't. For most individuals, they have their first onset of symptoms before the age of 19 or 20, and typically these flare-ups are severe. They have high fevers, they can have pain such as severe chest pain, abdominal pain, and sometimes it can be so bad that they actually take out your appendix or your gallbladder thinking that that's the cause. I myself am of Mediterranean descent, and I was diagnosed with FMF when I was 24 years old. I had flare-ups that were so severe that I would have a fever of 104 degrees, nausea, vomiting, diarrhea, severe abdominal pain, and people lived by Occam's razor. They thought the simplest explanation is the easiest, and this 19-year-old probably has appendicitis or a gallbladder problem. And you know what they did? They took out my appendix. They later took out my gallbladder. It wasn't until later when I had a doctor who was thinking critically through all of these kind of flare-ups that I had who said, something isn't right here, and I think we need to do some more investigation. And that doctor's critical thinking, even though she wasn't the one to actually diagnose me, she was the one to say, this needs more investigation, and she got me to someone who could do the diagnosing. I just want to empower you to always be that advocate for your patient, to think about all the different pieces of the puzzle, look at their history, and yes, although often when we hear hoofbeats we think horses, not zebras, sometimes it is zebras, and you as the nurse or whatever your clinical role may be, you may make a huge catch and make a really incredible change for this patient. Because I was diagnosed, I'm now able to be treated, and I went from 10 flare-ups a year, meaning days in the hospital each time, to maybe one, sometimes none. So I am forever thankful to that doctor, and I want to empower you to think critically in that way as well. Thanks so much, and happy studying.